Hello. I hope the beginning of the semester is going well for you. I wanted to go over and talk to you about the assignments for this week. So let me go ahead and pull it up here as far as what you're going to see. And when you sign on to the Brightspace and you go to course orientation and professional goal setting, module 1, you're going to see the topical outline, which you were able to see on the welcome video. And then you're going to see the PowerPoint. So if you open up the PowerPoint, you're going to see that there is a narrated PowerPoint as well as a PowerPoint with notes. There are two because I know that there's different types of learning styles, and some of you like audio. You like to hear a topic being discussed, whereas others are fine with just looking at the slide and looking underneath and seeing notes about whatever the slide is about. So please use whichever PowerPoint works best for you. As far as the narrated PowerPoint, if you opened this up, it's going to look like this. All right. So what I found though is that this picture blocks some of the content. So for subsequent videos or the audios, there will not be the picture there. You'll hear me talking, but my picture will not be there. All right. So let's go back and look at some of the other assignments. So as far as the discussion board, you're going to go ahead and click on this, go to discussion. Then you're going to see the question and you're going to click where it says your journey to the BSN. And when you click on that, it's going to open up an area with the question, but this is where you start a new thread. So you're going to start a new thread. You're going to enter your subject, week 1 or module 1 discussion board, and then maybe your last name, and then go ahead and type your initial post. It's important that you type it, but that you also copy it and save it to a Word document, just in case something goes wrong. You won't have to do it over. But please just use type it directly into this box for students to read so that they don't have to open up another document. All right. So go ahead and type your initial response in there, because then once you type your response and you post it, then you're able to see other students' initial responses, and then you'll be able to respond to 2 of your peers' posts. Okay. All right, for the next assignment, it's the PICO assignment. And so if you open it up, so it's going to look like, let me go in here. It's going to look like this. Go back, see where I put it. There. So you're going to develop a PICO question. And so you're going to go to the assignment and you'll see a place to open up the assignment to read the instructions. But you'll also see a rubric here so that you'll know exactly how the assignment's going to be graded. Each assignment will have a rubric, and it will tell you how many points each section is worth and how you get the full amount of points over here on the left. All right. So if we open up this assignment, which to do that, I have to go back out because Zoom doesn't like me to open up things. All right, it's going to look like this. And so what it describes what is a PICO question? The P stands for patient or population. In this example, we're going to say it's elderly patients with hypertension. Then you're going to look at the intervention. And what is our intervention? We're going to put the person on a low sodium diet. We want to compare that with the person who's not on any specific diet and see the outcome if it reduces the blood pressure. Now, if we wanted to do a time frame, we could decide how long do we want to have the study last. And this is just an example over 6 months. So you're going to formulate your question. When you write a question, it's in P, the population, does I, the intervention, compared to C, the comparison, result in O. So if we were to write this particular question, it would be in elderly patients with hypertension, which is our P, does implementing a low sodium diet, which is our I, our intervention, compared to no dietary modifications, C, our comparison, result in a reduction in blood pressure. That's our O. So you're going to actually just go ahead and type your question or your population in here. So just type right on the form here. We said older adults, but please don't use the same example because that's not going to teach you anything. So please come up with a question that you're interested in and put your population in here, type in your intervention, type in your comparison, and type in your outcome. And then down here, go ahead and type your whole question, which is going to be similar to this one up here. You want to make sure that your question is as clear and focused as possible. That's how you're going to find the best information about your topic. All right. And then you're just going to upload this to Brightspace. And so you'll upload the file. So you're going to save this after you type it out. You're going to save it, and then you're going to save it as a Word document and then upload it to Brightspace. All right. Our last assignment for this week is the quiz. And so as far as the quiz, you're going to let me go ahead and get on the right screen here so that I can show you. And I don't know if it's, okay, this is it. So you're going to go ahead and click on the quiz, and this page is going to open. Now, this is a preview, but this is what yours will look like. It will have a description, the details, it will say, have your name here, tells you the time is unlimited and how many attempts you have to complete this. Then you go down to the bottom here where it says start quiz. And when you click on that, it will open. So this particular quiz is about your syllabus and the RN to BSN handbook. All right. So please have those with you so that you can look up answers as you go through the quiz. All right. So I think that's all for this week. So I will try to do one of these videos every week about the assignment, just to sort of walk through your assignments with you. And then if you have further questions, please just give me a call on my cell phone or go ahead and email me, or you can text on the cell phone too. That's fine. So I hope that's helpful, and I will see you next time. Okay, bye-bye.